Mr. Speaker, with your leave, I rise to lend my support to the Appropriation Bill 2021-2020. But before I begin my presentation, Mr. Speaker, this morning I sat in here and I heard the Deputy Prime Minister say he was not surprised by the presentation we had this morning. But I would say I am disappointed with the presentation we had this morning. Because, Mr. Speaker, I've sat in this Parliament for many budget sessions, and we heard the same rhetoric every single budget cycle. The rhetoric haven't changed, Mr. Speaker. And why I am disappointed, Mr. Speaker, is because June 5th, 2020, I thought should have taught the opposition a lesson. Don't oppose for opposing's sake. Bring some substance to the debate. Simple as that, Mr. Speaker. And so I am hopeful that the other members of the opposition will be listening attentively as we make our presentations so that they can make some substantial contributions and they will bring something to the table of essence, Mr. Speaker. Because if they look amongst them, they would notice there's not many members of the opposition that was there over the previous cycles that sits with them now. And that is because it was the same thing over and over. And on June 5th, the Federation said enough is enough. Even went as far as changing a seat that's never been changed since we started the selection process. Because the message was clear. You're opposing for opposing's sake and not truly representing what the people want to hear, Mr. Speaker. Now, Mr. Speaker, the Prime Minister would have delivered a budget address under the theme, and I quote, Mr. Speaker, fortitude during the pandemic, resilience, recovery, and transformation. Mr. Speaker, I first would like to commend the Ministry of Finance and by extension, the Minister with responsibility for finance. And we have to understand something. I think I heard the Deputy say it enough time, the Honourable Member for number 5. Our Prime Minister doesn't just present a budget that somebody gave him. Our Prime Minister leads the budget, helps the Ministry of Finance because he understands what the budget is. He understands the finance. And that's why today we can say the country is where it is. And we are comfortable here in St. Kitts and Nevis because we have that sound leadership within finance. And so I want to commend the Minister for advancing such a robust budget, albeit in these difficult times, Mr. Speaker. Mr. Speaker, unquestionably, this budget is indeed reflective of a strong commitment to a stronger, safer future for all of the residents of St. Kitts and Nevis, Mr. Speaker. And Mr. Speaker, if one truly analyzes the budget, not just pick out parts of it that you want to oppose, but truly look at the budget, one would have come to the conclusion that despite the difficulties, financial and otherwise, triggered by Corona, this Team Unity government has maintained all, not some, all of our social safety net programs and has invested significantly in the fundamental and critical areas of our citizens' lives. And when we talk about the social safety net programs, Mr. Speaker, you can't just take part of it and call a number and say that is the whole. It does not contribute to the whole. Mr. Speaker, you have the Ministry of Health, you have the Ministry of Education, Social Services, Agriculture, National Security, all of which combined creates those social safety nets that are required for us to be able to continue to move on as a people, Mr. Speaker. Mr. Speaker, this budget undoubtedly illustrates the team unity government is reaffirming its commitment to the promise that all of our citizens, Mr. Speaker, not some of our citizens, but rather all of our citizens, truly are engaged in our journey that we're taking them on for this stronger, safer future. And a commitment that we have made during the last general election campaign. We understood what we came out of in the campaign, and we ain't going to take them lessons and just pretend like it ain't happened and we didn't hear what the people said. You're talking about listening to the people. Team Unity is listening and will continue to deliver. Mr. Speaker, the Team Unity is overwhelming, and my individual historic success in the June 2020 election have been a humbling experience. And now, Mr. Speaker, today, instead of standing here as a senator or deputy speaker, I have been catapulted to be the legitimate parliamentary representative for constituency number 3. And indeed, Mr. Speaker, I owe an immense debt of gratitude to the good people of St. Christopher III. They have placed immeasurable confidence in me and have enabled me to be able to be here at this point to address this honorable house in support of this budget and as their representative, but also in my capacity as Minister of Health, ICT, Entrepreneurship, Entertainment, and Talent Development, Mr. Speaker. And so, Mr. Speaker, I just want to thank the good people of Number 3 and remind them and to tell them that I commit to being your voice in Parliament and to ensure that the people of Number 3 truly benefits from the stronger, safer future that this government has laid out before us, Mr. Speaker. And on that note, I want to thank the Honourable Deputy Prime Minister for assisting the people of Trinity Heights with the water issue that they have been suffering from for so many years, going months without water. That has already been fixed. Already, we just start, but that has already been fixed. And I want to also thank the Minister of Sports for providing the Lime Keel basketball court with the new backboards. They've been asking for them for some time, and he was able to follow through and get that done for the good people of Number 3. And I want to thank the Deputy Prime Minister in advance for the roads that you did promise me. I don't know if you promised Eugene or not, but I know you promised me. So I'm looking forward to those roads in Number 3. I know the list is long, so I'm not expecting all. So I'm thanking you in advance. But by the end of the term, I'm sure we'll be able to get it done. Great. You hear it for yourself, he said, of course. Mr. Speaker, I now wish to proceed with a substantive aspect of my two-part presentation relative to the ministries of which I have oversight, commencing with the Ministry of Health. Mr. Speaker, when the World Health Organization declared the coronavirus a global pandemic in March 2020, St. Kitts and Nevis faced an unprecedented and colossal health challenge. We are all well aware, Mr. Speaker, that our country withstood the first wave of COVID-19, and we've become a global model for the successful containment of the virus and attaining much international acclaim. We saw our Prime Minister on, Sky News and BBC speaking about our success. They want to know how this small country that nobody really hear much about was able to do such big things, Mr. Speaker. Mr. Speaker, notwithstanding our success, I think it's important for me to debunk some recent notion by some persons that the COVID-19 pandemic is no longer a threat to the Federation of St. Kitts and Nevis. Mr. Speaker, this is so far from the truth. The reality, Mr. Speaker, is that the pandemic is far from over, and it is apt, and at this time, for me to appeal to everyone to continue to comply with the recommended non-pharmaceutical protocols which have enabled us to contain the virus thus far and for the foreseeable future until safe, and efficacious pharmaceutical measures are realized. Mr. Speaker, our success in St. Kitts and Nevis has not been automatic. Our success and fortunes, Mr. Speaker, have been substantially due to the strategic and astute leadership that has allowed us to successfully navigate the pandemic thus far. Being one of the only countries globally to be able to function as we are today, with our children going back to school, physically going back to school, persons going out to work, persons engaging in many basic day-to-day events in our country. We're even speaking about protocols for mass events, whereas some of our other regional partners are telling us we're crazy to be thinking that way. But yet we are doing it, Mr. Speaker. Mr. Speaker, we have been fortunate to have engaged the critical support of the Health Emergency Operating Center as part of a well-oiled, coordinated NEOC COVID-19 response mechanism, which is co-chaired by the NDC, Mr. Abdiel Samuel, and the Chief Medical Officer, Dr. Hazel Laws, with contribution from the Medical Chief of Staff, Dr. Cameron Wilkinson, and other members of that team. Mr. Speaker, this team has guided and directed us, enabling us to make often tough but nonetheless informed decisions that have ultimately kept us safe, Mr. Speaker. It was about saving lives, because once we save lives and we have lives that can continue to work, then they will be able to save our livelihood, Mr. Speaker. Mr. Speaker, yes, life first. Mr. Speaker, our efforts would have been ineffective if we were not able to foster that all of society approach that we spoke about. Multi-sectorial approach to surmount the pandemic, and also our brave frontline workers who are up to the task and challenge. If they were not, Mr. Speaker, we don't know where we would have been today. All of this, Mr. Speaker, would have been in vain. Permit me to extend the Ministry of Health and the country's gratitude to everyone for the role they played and have been playing, and for exhibiting a heightened spirit and solidarity of people and country, Mr. Speaker, for adopting and adhering to these essential new norms of mask wearing, physical distancing, and meticulous hand washing and hand sanitizing. Mr. Speaker, indeed, full and complete adaptation to these simple protective measures would certainly promote an immense sense of comfort and normalcy among us, Mr. Speaker. However, I reiterate, Mr. Speaker, the pandemic is far from over. In fact, Mr. Speaker, we have been observing the gruesome surge in cases and daily staggering, monumental loss of lives being experienced by global powers. And Mr. Speaker, just today, we are looking at totals confirmed cases, 71,919,725. Deaths, 1,623,064, Mr. Speaker. In St. Kitts and Nevis, we have 28 confirmed cases, with 4 that are still active, Mr. Speaker. To date, we have tested somewhere around 4,594 persons, Mr. Speaker. And of that 4,594, 28 were confirmed cases, Mr. Speaker. Mr. Speaker, the countries are renowned, these global powers are renowned for their massive resources. Yet, Mr. Speaker, the infrastructure is incapable of combating the virus. And it is extremely and painfully clear, Mr. Speaker, that they are overwhelmed. As the Prime Minister submitted in his presentation, the criterion regarding success in managing the virus is now the degree of mortality and the number of deaths per day. Mr. Speaker, we can certainly purport a strong claim that we are inundated with CNN's daily reports of the numbers of deaths in the great USA, Mr. Speaker. It is therefore imperative, Mr. Speaker, that as a small island federation, that we continue to be guided by the protocols and measures that has brought us safely to this point and which we'll have to rely on for the immediate and short-term future until we obtain a vaccine, Mr. Speaker. Yes, Mr. Speaker, indeed countries such as the United States and the United Kingdom have provided the emergency use authorization for the Pfizer vaccine. But Mr. Speaker, that doesn't mean that it's over. For the vaccine will require time in order for it to do its work. It needs time for the requisite penetration. It needs time to build up the herd immunity required before we can say the pandemic is over. I deem it my responsibility, therefore, to make a strong appeal, Mr. Speaker, to all. Wear your mask, employ your proper hand hygiene, and social distance. That is what brought us to this point. That is what will continue to take us until we are able to see the herd immunity expected, which isn't anytime soon, Mr. Speaker. Mr. Speaker, the year 2020 has not only tested our resolve, it has also challenged the continuity of vital programs, policies, and work of the Ministry of Health, Mr. Speaker. The ministry, therefore, had to ensure that it was able to exercise its fundamental mandate and coexist with the dreaded pandemic, while at the same time protecting its gains in other critical aspects of health. It must be borne in mind, Mr. Speaker, that in its 2020 manifesto, several promises relative to a stronger, more resilient healthcare sector were made to the people by our Team Unity government. In addition, Mr. Speaker, we had affirmed our commitment and significant buy-in to the United Nations Sustainable Development Goal number 3, family health, good health, and well-being. We are a government and a team who believe in keeping our promises, Mr. Speaker, of leaving no one behind, because the Ministry of Health is committed to providing health care for all, embracing the basic tenets, care that is available, care that is equitable, and care that is accessible and affordable for all its people. Talk about social safety nets, Mr. Speaker. It would be instructive of me to remind this August gathering of some of the Health Ministry's pertinent deliverables under the Team Unity government and to make a valid determination of our accomplishments. These include, Mr. Speaker, but are not limited to the following. Further build-out of the Ministry's program to reduce non-communicable diseases such as cancer, diabetes, and heart disease, which account for about 83% of all deaths in the Federation, lowering our communicable disease statistics, commissioning and construction of Phase 3 of the JNF General Hospital, completing the cardiac catheterization unit at JNF General Hospital within the first year of a new term to address cardiac cases and lessen the likelihood of dying from a heart attack. Construction of a new state-of-the-art health center in St. Peter's, and refurbish the Bastia Health Center and construct a new building at the current location to facilitate the operations of our community-based health services. Mr. Speaker, having placed a strong focus on these areas in true alignment with the ministry's motto, people first, quality always, I am pleased to speak to these deliverables of the ministry's strategic plan as we simultaneously focus on the COVID-19 pandemic. Mr. Speaker, since I've been in this parliament, I have been hearing the reports and startling statistics relative to chronic non-communicable diseases and their potent threat to health and country. And now, as Minister with responsibility for health, I am seeing the glaring statistics and observing the adverse effects that NCDs have on individuals, families, communities, and our health system. Mr. Speaker, I am immensely pleased to share that the Ministry of Health, having engaged in robust outreach activities to reduce the incidence and impact of non-communicable diseases, has realized significant returns. Our epidemiological statistics have revealed that over the period 2015, and this is important to note, between the period 2015 to 2020, the incidence of new cases of diabetes and hypertension has decreased by 46.9% for diabetes and 44.7% for hypertension. Mr. Speaker, yes, this is indeed incredible data. Further, Mr. Speaker, the average mortality data, that is, the number of deaths associated with diabetes and high blood pressure, are notably trending downwards to 63% from 83%. And I'm happy the former minister just stepped in because we have to give her congratulations for the work that she has done within the ministry, because it was under her leadership we were able to see these decreases, Mr. Speaker. Mr. Speaker, this is certainly indicative of the fact that the ministry is doing what it promises to do, influencing lifestyle changes, scale-up screening, and detecting new cases of NCDs and linking those cases to management and care. Further, Mr. Speaker, this achievement can be linked to the 3-year Taiwanese St. Kitts Nevis renal kidney program, which concluded in April of this year. I assure you, Mr. Speaker, that the start of a new project, capacity building for the prevention and control of chronic metabolic diseases in St. Christopher and Nevis, which is expected to be completed by April of 2024, will realize further significant benefits, noting that this project has been adopted from the World Health Organization chronic care model, adopting 3 main approaches to reduce the impact of chronic diseases on the global health system. These are integrated care strategies and practices, strengthen healthcare capacity for the chronic metabolic diseases at medical institutions, and enhance the public's self-management capabilities relative to the metabolic diseases. It is also important that we note, Mr. Speaker, that owing to the government's strong cooperation with the Taiwanese government, the Ministry of Health has secured the additional vital services of a volunteer diabetes educator from Taiwan who has been working closely with the staff of the Health Promotion Unit and engaging in outreach at community health centers to empower persons with diabetes to successfully manage their condition, Mr. Speaker. As a matter of fact, next year we will see the start of what we are calling In Your Kitchen, which would be a series teaching persons how to cook healthier to ensure that we reduce our cases with diabetes, and those persons living with diabetes are able to manage their cases by eating healthy, Mr. Speaker. These initiatives have added immense value to the health sector, resulting in decreased numbers of persons with diabetes who would normally rely on the system for care. Mr. Speaker, the ministry will also endeavor to complete several key initiatives by end of 2021 to mitigate against NCDs. These include the reactivation of the NCD Commission, an entity that will provide oversight of the prevention and management of NCDs in the Federation, and the development of the National Tobacco Control Act aimed at reducing the use of tobacco products in the Federation, since such products confer a high predisposition to the onset of NCDs. Further, the Ministry's success of the SKN Moves, which was launched in August of 2020, has been instrumental in our initiative to address the onset of NCDs through increased physical activity and exercise, capitalizing on healthier food choices, and engaging in regular medical health checks. And Mr. Speaker, I want to thank the Prime Minister for buying into SKN Moves, and as we know, his monthly PM walk is also in collaboration with SKN Moves. As a matter of fact, the Minister of Health of Jamaica would have also commended the Prime Minister for the efforts that he had placed in making sure that SKN Moves, which was birthed out of an idea from Jamaica, and Jamaica Moves is the success that it is here in St. Kitts and Nevis. And in 2021, Mr. Speaker, we intend to make SKN Moves even more visible in St. Kitts and Nevis, Mr. Speaker. Mr. Speaker, allow me now to turn our attention to communicable diseases. Mr. Speaker, just a few months ago, I would have participated in a meeting with the director of PANCAP. Mr. Speaker, in that meeting, and just so persons know, PANCAP is the Pan-American Partnership Against HIV/AIDS. In that meeting, Mr. Speaker, he would have emphasized the importance of our region, but more importantly, St. Kitts and Nevis, ensuring that we attain our UNAID 90-90-90 targets, which refers to 3 key steps that are essential to both better health and care for HIV-positive people and to limiting new infections and the further spread of HIV. HIV is still real, and so attention must be paid, Mr. Speaker. Mr. Speaker, currently, St. Kitts and Nevis is at 91-48-50. And what does this 90-90 mean? 90-90-90 mean, Mr. Speaker? It means that 90% of all people living with HIV should know their status. St. Kitts is at 91%. St. Kitts and Nevis is at 91%. The second 90 means 90% of all those who are diagnosed with HIV positive to be sustained antiretroviral treatment, ART. St. Kitts is at 48% relative to that 90. And the third 90 refers to 90% of those on ART having an undetectable viral load. Currently, St. Kitts and Nevis is at 50% of that 90. And so, Mr. Speaker, that means we have some work to do. And so, Mr. Speaker, the Ministry of Health understands the importance of achieving the 90-90-90 targets, and as such assures that we are committed to strengthening the prevention, management, and control of HIV and other sexually transmitted infections as well, including syphilis, and reaffirms our commitment to the equitable distribution and access to safe diagnostics, therapeutics, and vaccines, and to complete the strategic plan for HIV/AIDS. Certainly, we are pleased, Mr. Speaker, that the Federation has been able to maintain and sustain an inviolable 100% elimination of mother-to-child transmission of HIV and syphilis, owing to the progressive work of maternal and child health practitioners. Mr. Speaker, however, between 2015 and October 2020, there were about 81 new cases, that is an average of 13 cases per annum, of which 66.6% are male, and a startling 42%, Mr. Speaker, are under 30 years of age, Mr. Speaker. And so it is important that we continue to put much effort into our fight against HIV/AIDS, Mr. Speaker. However, Mr. Speaker, I am also pleased to inform that according to the data from the syndromic surveillance report, overall, our communicable disease, overall, the statistics have decreased by 28.3%. This is indeed great progress in our program. You hear, before the last election, we heard so many negatives coming out from the opposition about the Ministry of Health. But here it is that there are actually things that are happening in the Ministry of Health and progress that is being made. Positive. We understand that much more work needs to be done, Mr. Speaker, and we are working towards making sure we are able to reach all of our targets and reduce our numbers as much as possible, Mr. Speaker. Mr. Speaker, one of the areas that is important to me, one of the areas that I have much concern about is our mental health and substance abuse, Mr. Speaker. Mr. Speaker, the ministry continues to place a strong focus on mental health, particularly during this period. This aligns with the government's mission to transform healthcare outside hospitals and facilitate service integration at the primary care level. And that is an area that we will be focusing on quite a bit in 2021, Mr. Speaker, the primary care level. Mr. Speaker, in 2019, we saw an increase in mental health clients of some 8% to around 440 known clients. Mr. Speaker, it's important for me to stress known clients, because when I looked at the report from the community health nurse who has responsibility for mental health, it would have indicated, or she indicated rather, that there is a hidden population of mentally ill patients who have fallen out of the system due to stigma, lack of family support, and inadequate supportive facilities, Mr. Speaker. And so, Mr. Speaker, that is why the ministry believes that the integration of mental health allows us to bridge the mental health gap. The Dr. Arthur Lake Mental Health Day Treatment Center, Mr. Speaker, continues to become increasingly functional, and the ministry has recruited another psychiatrist and trained nurses to fulfill the psychiatric needs of the country, Mr. Speaker. Mr. Speaker, the ministry intends to strengthen the service with the finalization of our mental health legislation and the mental health gap implementation plan, as well as building the capacity to the training of our district medical officers, because we understand that they are in the communities and they may be the first line of access to persons with mental health issues. And so giving them the training necessary to pick up and identify and treat these individuals at the district level, because in some cases, many of them wouldn't want to leave the district for assistance. So if we could get our district medical officers trained, they will be able to help us in supporting persons with mental health issues. So I hope that the Deputy Speaker is paying attention. Mr. Speaker, the ministry also intends to address the existing deficits of the psychiatric unit at the JNF General Hospital during the Phase 3 development of the Joseph N. France Hospital. We understand that it's come to its capacity limits. And I pause because I hate to have to say that we are at the capacity limits for mental health treatment at the psychiatric ward. And so we understand that something must be done. And we understand that it's not just about the institutional base, however. Something must be done also means that within the primary health sector, we have to be able to fill that gap, Mr. Speaker. Mr. Speaker, the ministry continues to do all it can to train, retain, and supplement our human resources. As such, the ministry have had several health personnel engaged in various training opportunities at the local, regional, and international levels in alignment with the Human Resource for Health Plan of Action 2018 to 2022. The ministry has also implemented the PAHO National Health Workforce Statistics Platform to promote better interfacing, monitoring, and accountability of human resources. Mr. Speaker, one of the main challenges faced by the ministry is that of insufficient local nursing staff, particularly specialist nurses, which necessitates significant recruitment activities from other countries, mainly from the Philippines and Cuba. And that is something I kept hearing over and over from our previous Minister of Health, the Honorable Senator Phipps. She would always make that plea that we need more specialist nurses, more specialist doctors. Currently, Mr. Speaker, there are adequate numbers of general medical practitioners, but we have a shortage of local specialist medical practitioners, and the ministry has had to rely on its cooperative partnership with the Cuban government for mainly specialist medical personnel. It is the intention of this ministry, however, to be able to collaborate much closer with the Human Resource Department so that we can target specialized training and develop and strengthen our human resource capacities. And Mr. Speaker, I just want to appeal to persons to consider the more specialized areas. Consider the specialized areas in nursing and in medicine. We need them. We need radiologists. We need persons in the laboratories. We need persons in other specialized areas in medicine. And there's a lot of opportunities out there. And I implore you to come into the ministry. If you're someone who is interested in sciences, come into the ministry. Let us help you identify a career path which is going to be of service to your nation once you return. And so I'm just making that appeal. Mr. Speaker, the ministry understands that innovation, digital transformation, and adequate knowledge sharing will provide the leverage for an efficient health information system. As such, the ministry is accelerating its efforts to build out and fully execute its health information system at all hospitals and community-based institutions to address the gaps in communication for an enhanced client information and referral system within the health sector. Mr. Speaker, the process has already commenced with additional employment and retraining of staff in collaboration with the Ministry of Information and Communications Technology. Mr. Speaker, the ministry is cognizant of a growing and evolving need to develop and integrate systems that seamlessly aggregate information, create a database across components of the ministry, eliminate redundancies, and improve accessibility to clients' data, thus maximizing the care clients receive and raising the profile of our healthcare system. And so the ministry will do all in its efforts to ensure that we improve on our health information systems, Mr. Speaker. Mr. Speaker, at this juncture, I think it's important for us to note that the government has invested a significant amount of funds to procure essential COVID-19 related equipment and supplies for the Ministry of Health. It is therefore expected that in return, some revenues must be realized in order for us to sustain the health sector. And I know when the Minister with responsibility for the National Health Insurance come, he will speak more in detail on the plans as it pertains to the National Health Insurance. Mr. Speaker, there are a number of capital projects that will be undertaken by the Ministry of Health in 2021. These projects are intended to support aspects of the ministry's ongoing work to provide quality care to the population of St. Kitts and Nevis. Some of these projects, Mr. Speaker, include, and we've spoken about them quite a bit, the construction of the new health center in St. Peter's. The expectation is that this health center and this facility will be a modern facility that would replace the existing termite-infested, dilapidated structure, which has become unsuitable to provide quality, evidence-based primary health care services to the over 4,000 consumers of the healthcare sector in that area and the surrounding environments. We will make sure that this facility is properly equipped, has proper parking, and that individuals and families will be able to access care successfully, Mr. Speaker. Mr. Speaker, other health sector improvements would include our continued work with the Public Works Department. I know the Deputy Prime Minister would have spoken about the fact that Public Works do quite a bit, not just as Public Works, but for quite a number of other ministries. And so with the help of Public Work, we will continue to build out our projects to improve the health sector infrastructure. And one of the initiatives which I mentioned earlier would be the Bastia Health Center, which would include the vital components of the main community public health facility, as well as the environment and the maintenance units. At the institutional level, Mr. Speaker, focus will be placed on improvements to the infrastructure and service delivery of our health institution. One such area will focus on work regarding the general infrastructure expansion of the Carden home, which is expected to commence in 2021. Our elderly need to be able to be in a safe environment, a comfortable environment, and even at this point, our Carden home is at capacity, and it is important for us to be able to do some expansion so that we can be able to house even more of our elderlies at that facility, Mr. Speaker. As I mentioned earlier, we will also see the commencement of the construction of the cardiac catheterization unit to address the increasing local needs of our clients with heart issues, Mr. Speaker. The unit will include essential cardio equipment to align with all international standards. Mr. Speaker, we've heard about the Phase 3 project of Joseph and France. As a matter of fact, this Phase 3 project should have already been done since 2004. But here I am in 2020 speaking to the budget of 2021, and we're speaking about the Joseph and France General Hospital upgrade, Mr. Speaker. We know that during the first phases, we would have seen the construction of the accident and emergency area, radiography, laboratory, pharmacy, operating theater, the wards, and the administration building. However, there's other work that needs to be done to upgrade the facilities, and so in 2021 we will embark on a plan to move forward with the renovations, but specifically to the areas such as the mortuary and the pathology lab, to make sure it is at international standards, the central medical stores, to make sure that we have adequate storage for all of our medical supplies or drugs, etc. The laundry facility, so that it will be more effective and efficient. The kitchen and the kitchen stores area that will be built according to standards to accommodate the appropriate culinary and dietary requirements and services of the Joseph and France General Hospital. The central sterilization unit, which will be built to international standards to facilitate proper and quality assured sterilization of the hospital equipment and material, and the maintenance workshop, which will be built to accommodate the maintenance and repairs for personnel and their functions. Mr. Speaker, we are nearing the completion of the design of both the Phase 3 of the JNF General Hospital as well as the cardiac unit, which is being done by the firm Design Collaborative with headquarters in Barbados. Mr. Speaker, I would now like to turn my attention to COVID-19, Mr. Speaker, because that has become one of the main highlights within the Ministry of Health, apart from everything that we have to do. It's an ongoing pandemic that we're hoping that we will see some light in 2021, but nonetheless, it is important for me to speak to this pandemic, Mr. Speaker. Mr. Speaker, it is true that the pandemic has highlighted specific vulnerabilities of certain population groups, as well as exposed several structural weaknesses within the healthcare system. However, it has also provided an enormous opportunity to substantively reform and transform the health sector into a system that continues to evolve towards a high state of preparedness. And Mr. Speaker, the Ministry of Health intends to use this time to evolve. Mr. Speaker, allow me at this juncture to thank several of our partners in health who have provided the ministry with much needed support through donations and otherwise. Mr. Speaker, we wish to commend the considerable cooperation of the governments such as the Republic of China, Taiwan, India, Cuba for augmenting our health sector with specialist nurses and doctors, and the USA as well for their tremendous support, and entities such as WHO, PAHO, CARICOM, OECS, CARPHA, and IAEA, who have contributed to our success since the ministry submits that the only way out of the pandemic is through national unity and global solidarity. Mr. Speaker, the Republic of China, Taiwan has provided St. Kitts and Nevis with expert knowledge and guidance regarding the management of the COVID-19. They donated thousands of medical masks, forehead thermometers, ventilators, infrared thermal imaging cameras, among other critical supplies, Mr. Speaker. They've also provided us with expert review of our national pandemic response plan, given their country's success in handling the SARS epidemic of 2003. Mr. Speaker, the ministry is also grateful for the response by the Ministry of Finance to the Minister of Finance with providing the ministry with an additional 12.4 million. So if you're asking where that surplus money went, 12.4 million went to support our efforts to fight the COVID-19, Mr. Speaker. These funds were used to procure much needed medical supplies, quarantine facilities, testing, pharmaceuticals, and other health-related items, Mr. Speaker. Mr. Speaker, there have also been quite a bit of work done in order for us to, leading up to and since the borders have been reopened. Mr. Speaker, the VIP lounge in the arrivals hall of the RLB International have been transformed into the Port Health Surveillance offices. And the same space for Port Health Surveillance is also located at the Vance Amory Airport in Nevis. Mr. Speaker, as of yesterday, December 15th, our Port Health Surveillance officers have processed a total of 1,177 passengers, 927 in St. Kitts and 250 on Nevis. Of those passengers, a total of 114 passengers were tested on arrival, 100 in St. Kitts and 14 in Nevis. The ministry, through the assistance of PAHO, was also able to bring 4 IT technicians on staff. These technicians have been charged with the responsibility of vetting all health forms prior to entry, ensuring that persons have supplied all relevant and important information before approval can be granted for entry. They also reach out to these passengers to request any further information that may be required. Allow me to commend, therefore, Mr. Speaker, the work of the Department of Technology who assisted in our COVID efforts and building of the KNATravelform.kn website, which is now where persons go to complete the health, immigration, and customs form prior to arrival in St. Kitts and Nevis. Once an inbound passenger completes the forms, the health IT technicians will receive the forms relating to health for vetting, immigration receives the immigration forms, and customs receives the customs-related form. This website, along with the covid19.gov.kn website, were all built and is being maintained by the staff of the Department of Technology under the guidance of Ms. Ophelia Blanchard. And we must commend the young persons within the department for the work that they have done and which they continue to do, Mr. Speaker. Mr. Speaker, I'm sorry. At this point, I wish to turn my attention to the other ministries of which I have responsibility. Sorry. Mr. Speaker, the COVID-19 pandemic has triggered all economies to fast-track commerce and digitalization plans. The hard truth, Mr. Speaker, is that businesses and jurisdictions that fail to adapt quickly will suffer severe economic hardship or even extinction, Mr. Speaker. The Caribbean, and St. Kitts and Nevis in particular, has a small window of opportunity to quickly deploy digitalization strategies to remain relevant to foreign inward investments, leverage online entertainment and talent, and be perceived as the ideal place to work remotely for major international businesses, entrepreneurs, artists, and high net worth individuals. Mr. Speaker, over the last 9 months or so, St. Kitts and Nevis has seen an increase in the use of online government information and services, such as payment of taxes, accessing social services, purchasing of food, and delivery services. There has been an emergence of new entrepreneurs in the tech industry who are developing websites, mobile applications, and infographic design and dissemination. New tech businesses which provide mobile payment solutions such as Jad Cash and Carry Pay and 869 2Go, which offers food delivery services. Mr. Speaker, we have seen an increased use of online collaboration and conference tools by community groups, churches, businesses, and government. Businesses have increased investment in technology to augment the way they deliver goods and services. Light manufacturing companies are integrating the use of robotics and innovation for conducting sanitary and temperature checks of employees and consumers within the workplace. Mr. Speaker, just a few months ago, we would have seen the launch of the St. Kitts and Nevis Robotics Association, the first of its kind in the OECS in particular, and I've heard that the ECCB have even gone further and have asked them to consider the OECS Robotics Association as well. Mr. Speaker, these are a group of young persons who have been competing in robotic tournaments around the world and have been successfully doing so. And now they have formed an association to legalize the work that they do, Mr. Speaker. Mr. Speaker, in 2019, the government embarked on a strategic path to accelerate towards an innovative digital economy through the implementation of a digital transformation strategy 2020 to 2022. Mr. Speaker, this strategy comprises of the following initiatives: ensuring customer-centric experiences, empowering public servants, enabling digital government, creating a data-driven environment, and driving innovation in government. And Mr. Speaker, at this point, I would like to thank the Attorney General, who would have been the Minister of Responsibility. He is very much behind and supports the digital economy and the digital transformation, and he has been the one who has been leading. And so, Mr. Speaker, I just want to thank him for the work that he has done thus far. Mr. Speaker, our vision is to make St. Kitts and Nevis a world leader in digital services delivery for citizens, residents, the private sector, and investors in a manner that is safe, efficient, interactive, and responsive to the needs of end users, and which would allow for economic growth and contribute to national development. Our approach, Mr. Speaker, is simple but important. and that is to ensure that the foundational elements are implemented from the onset. It is for this reason we are developing our whole of government technology strategy as well as our cybersecurity strategy, both of which have already begun, Mr. Speaker. Mr. Speaker, we are looking at a structural approach to technology implementation. We want to be able to strengthen government-wide area network, ensure broadband connectivity across the whole of government and through public-private partnership with local internet service providers. And we heard the Prime Minister yesterday speak to our collaboration with the cable, who are assisting with these types of projects and who have also committed to delivering fiber to the home and Wi-Fi hotspots within communities in a way that is robust and deliver high quality and affordable prices to our consumers, Mr. Speaker. Mr. Speaker, the government has initiated the steps towards the modernization of legislation governing the electronic communications sector. The EC Bill, as it is known as, of 2020 received its first reading in Parliament back in August of this year, Mr. Speaker. This new legislation that will eventually replace the Telecommunications Act, Cap 16.05, and provide an upgraded regulatory framework for the telecommunications and ICT sectors. Mr. Speaker, in terms of security, we do understand the importance of ensuring the security and integrity of the government's data in the process. And so apart from our cybersecurity strategy that we are developing, our National ICT Center is in the process of implementing the ISO 27001 Information Security Management System, and this is expected to be completed by the end of 2021. Why is this important, Mr. Speaker? It's because having an ISO 27001 certification demonstrates that our government have identified the risks, assessed the implications, and put in place systemized controls to limit any damage to the information systems and the data stored on these systems, Mr. Speaker. So, Mr. Speaker, what have we accomplished thus far on our journey towards digital transformation? Mr. Speaker, so far, we have already launched a website for our Ministry of Justice and Legal Affairs, which is an online laws database of statutes and subsidiary legislation of St. Kitts and Nevis. And this has been made accessible to the general public. I'm sure the AG can speak to that one. We are actually in the process as well of digitizing the land records with assistance from the Republic of China, Taiwan. This will result in the creation of an online searchable database for land data to enable attorneys at law and the general public to perform electronic searches of titles. So nobody would have to be calling me personally to ask me if I know if this lot that has been overgrown for over 100 years is still available. You can just go to that registry, that database, and be able to find that information. Mr. Speaker, as I would have spoken to earlier, we are also implementing the health information system. And under this project, medical records at the major health institutions, namely the Joseph N. France General Hospital on St. Kitts, as well as the Alexandria Hospital on Nevis, are going to be digitized. The HIS has the potential to allow for real-time updates and remote access by medical staff, while ensuring that there is a high level of security to safeguard the confidentiality of patient records. In support of the HIS, medical ID cards are being provided to patients for ease of identification and information recall. So I won't hear persons coming and complaining that I just went to the hospital this morning, I gave you all of my information, I come back in the afternoon at 2 o'clock, I still have to give you all this information again? With a swipe of your medical ID card, all your medical information, and all the visits you've made, not only at our institutional base, that is JNF, Pogson, Mary Charles, Alexandria, but also the information would be from the community health center. So if you access service within our community health centers, That information will also be stored what's on your medical record, which will then be accessible by all of our medical doctors within the hospital and eventually with all the practitioners throughout the country. I see that the DMO among us is very happy to hear that. Mr. Speaker, during the Prime Minister's budget address, he would have spoken to the online payment platform and the completion of the selection process to determine the best fit. Over the course of 2021, we would see the start of this project. This project would allow government to be more accessible by citizens, Mr. Speaker. And so these are some of the things that we have already started, that are in process, and which will be completed within 2021. And so our steps towards digital transformation is on its way, Mr. Speaker. And I must commend the Department of Technology and specifically the e-government unit, who continue to work tirelessly to continue to build websites and applications that has moved us in some departments and ministries from paper-based into digital platforms, Mr. Speaker. And that way it would make our transformation much smoother and easier, Mr. Speaker. Mr. Speaker, I would now like to turn my attention to the new ministry. And I'm getting close to the end. I think even my voice is deciding that it no longer wants to continue. But Mr. Speaker, I wish to turn my attention to the Ministry of Entrepreneurship, Entertainment, and Talent Development. Mr. Speaker, Team Unity's commitment to harness and develop the creative and innovative energies of the residents of St. Kitts and Nevis is being realized by this new ministry, Mr. Speaker. Mr. Speaker, this new ministry is mandated to transform the entertainment, creative, and innovative industries of St. Kitts and Nevis through entrepreneurship and economic value creation. The main aim being to create the right ecosystem which will allow entrepreneurs to reignite, flourish, and remain resilient in these critical times brought about by COVID-19 pandemic and beyond. Mr. Speaker, it is anticipated that this ministry's projects, programs, and policies will be designed to, among other things, develop an industry that would allow creatives and innovators to ply their trade effectively in the Federation of St. Kitts and Nevis, develop legislation to guide the innovation and entertainment industries, to professionalize the arts, entertainment, and innovation industries through value creation and harmonization of standards, and to catalyze a cultural shift to support existing and aspiring entrepreneurs in the creative and innovative industries. Mr. Speaker, as the ministry begins to roll out its projects and programs, the general public can expect to see over the course of next year the increase is in engagement and participation in the creative and innovative industries, improvement in the resources, facilities, and opportunities and access to same needed to support persons in the creative and innovative industries, technical assistance being provided to persons in the creative and innovative industries in the areas of business management, financing, sales and marketing, quality production, networking, promotion and distribution, image and branding, talent management and export, promotion of the creative and innovative culture, products and endeavors of St. Kitts and Nevis, both nationally and internationally, creation and facilitation of various pathways to the economic transformation of young people and their families, and facilitation of the export and exchange of talent internationally, including the use, participation, and engagement of innovation talent tourists. Mr. Speaker, the ministry will continue to prioritize consultations with entrepreneurs providing creative and innovative services and other key industry stakeholders to tailor the ministry's service delivery to their needs and to inform its wider strategic planning. It is anticipated that following the first full year of operation, the ministry will be positioned to broaden and deepen its service provision through the launch of innovative programs and projects, and to plan major capital projects, policy development, and propose legislation. This ministry will also capitalize on collaborating with private sector partners to incorporate industry best practices, assist in service delivery, and enable the ministry to maximize its reach and impact among creatives, innovators, and entrepreneurs providing related services. And I think we would have heard that within the Prime Minister's budget address as well, where he would have indicated our continued work with the Small Business Development Unit, as well as the Intellectual Property Department, as well as we have also been in communication with the Chamber to allow us to be able to even consider mentoring opportunities for persons who are considering entrepreneurship endeavors, Mr. Speaker. Mr. Speaker, St. Kitts and Nevis is home to very talented individuals and groups who continue to produce and display creative and innovative content, products, and services. They range from literary and performing artists to photographers and videographers, and from application and website developers to robotic innovators, with many others in between. The creative and innovative industries attract the many talents of our citizens and residents who, over the last 5 years, have increased their creative and innovative output substantially. Mr. Speaker, the Federation also boasts of a growing group of persons involved in entrepreneurial pursuits in different economic sectors. The rapid increase in small and medium enterprises has led to the increased employment, sustainable jobs, and economic empowerment of people starting or expanding their businesses. And we believe, Mr. Speaker, that combining value-rich, creative, and innovative industries with the income and generating potential of entrepreneurship promises to create a range of new sources of sustainable economic activity and provide employment and economic independence for thousands of citizens and residents, Mr. Speaker. Mr. Speaker, the time is now for us to make the shift, Mr. Speaker, and it's ripe for us to make that shift, to be able to have a new industry that our young people and the Federation in general could be able to sustain and be able to reap benefits in the long run, Mr. Speaker. On a national level, promoting entrepreneurship in the creative and innovative industries forms part of the government's targeted approach to further extend the diversification of the economy and build economic resilience through revenue generation and increased employment, Mr. Speaker. And I know there are persons out there who are looking forward to hear, what will this new ministry do? The good thing is that we have been engaged in many discussions with persons within the area, within the field, specifically the members of PACE and other persons within the entertainment and the creative as well as the innovative field, because we understand that it is important and vital that we get a good cross-section of the stakeholders involved within that industry to help shape this new ministry, Mr. Speaker. And throughout 2021, we will continue to engage these individuals because we want this ministry to be able to work on their behalf. We want them to have an input. This is the first time in a very long time. I don't think any of us can even remember the time since we have government that we've heard of a new ministry. And the opportunity has now presented itself. And so it is important that we allow the persons within this space to be able to help guide how this new ministry will be able to function and grow. And so we are looking forward to what 2021 holds in allowing us to be able to build out the structures and the function of this ministry. And we know that by the end of this first term, this new ministry would create an environment that allows persons within those parts who are very talented artists, people, the producers, everyone, to be able to have that type of base upon which they can then propel their careers outside of St. Kitts and Nevis. So it's about us allowing or helping them to release that talent out into the regional and international sphere as well, Mr. Speaker. And so, Mr. Speaker, I've said a lot. I think this is the first time I've talked this much in Parliament. It has been, yes. I know, but it's the first time I talk. I don't normally talk this long. I don't like talk long. That's what it is now. This is the first time I talk this long. But hopefully, good. But hopefully, what I was able to do today is share what the vision is for the ministries upon which I have responsibility. And I'm hopeful that in 2021, we'll be able to see a lot of our programs and plans and policies roll out. And that by the end of 2021, I'll be able to be successfully reporting on the achievements of the ministries of health, ICT, entrepreneurship, entertainment, and talent development. Mr. Speaker, with that, I commend this bill to the Honourable House, and I will now sit back and listen to the other members as we, on all sides for sure, continue to add substance to this debate on this bill. May it please you, Mr. Speaker.